November is National Diabetes Awareness Month. And this morning, public health educator Jaquita Sterling joins me now to give us some management tips this morning. Great to have you here this morning.
Thank you so much.
So this is, a problem that affects so many Americans, so many people. It just is a big problem. And I guess the point of having this Awareness Month is simply to raise awareness for this problem.
That is correct. 1 in every 10 people has diabetes, and many of them are not even aware of it. And so the month of November is to raise awareness and to just provide options and resources for those who may have diabetes or who has a family member that might be diagnosed with diabetes.
Okay, so in talking about that, then I guess that's a risk. What are some risk factors then that kind of put you in that category?
So when it comes to risk factors, there are 2 categories.
Okay.
The first one are modifiable, which you can make a change to. And so those are things like your level of physical activity, how you eat, how you manage stress, and maintaining, a healthy weight.
Right.
Then we have non-modifiables, which we cannot change, like our age. The older we get, the harder it is for our body to, to do certain processes and to work. When it comes to our race or ethnicity, African Americans, Hispanics, Native Americans are more likely to be diagnosed with diabetes. And so those things we cannot change,
Sure.
but what we can change, we should go ahead and start doing that.
Right, and that is, again, what you said when you're talking about dieting, just things that we kind of know, but it's always so good when I have you guys on to just kind of reiterate those things that we kind of already know. So diet, talk to me about some good tips that we need to be doing if you fall in, especially if you fall into that category of being at greater
Sure,
risk.
I know when it comes to diet, it is kind of difficult because we have our family traditions, foods that we like
Holidays,
to eat.
I know.
We are around the holiday season,
Right,
and
right.
so there are a lot of foods that we enjoy eating, but eating foods that are fresh. So
Right.
our fresh fruits, our fresh vegetables. Of course, you want to eat your proteins,
Right.
but you you want to watch the amount of carbohydrates that you eat. Also, when it comes to nutrition, it's the amount that you eat and also when you eat is very important when you're a diabetic.
Right, and of course moving, exercise
Exercising is very important. So carbohydrates are important, but a lot of people are saying, well, if I'm a diabetic, I'm going to stay away from carbs. That is not true. We need carbs to give us energy to
Right.
move and to do things and for our heart to pump and for us to breathe, but we don't put in enough minutes.
Right, and it's the healthy carbs, the
it's
good
the healthy
carbs.
carbs.
They're
It's the
so
good carbs.
hard to get because, you think carbs for energy, but so many of those bars and things
Exactly.
are loaded with sugar.
A lot of it-
So I
heavy
guess a lot of
sugars.
it, checking your labels, of course, is always a good thing, I guess, to do
It
that.
is a good thing. Check your labels. As you mentioned, they're healthier carbs. And so you want to eat more fresh foods that are carbs, such as, your healthy potatoes or brown rice. They're using whole wheat flour, things
Right.
that can keep you full a lot longer rather than snacking on things throughout the day that can raise your blood sugar levels.
Right, okay, and again, you talked about some things that we couldn't change. There's also a diabetes belt, and we're not talking about the belt necessarily around your waist. We're talking about an area in which you live. Talk to me a little bit about that.
So the diabetes belt, I'm sure you've heard of the Bible belt, and then we have the obesity belt, and there is a diabetes belt, and Hamilton County falls right into that belt. And it's that area where people are more likely to be diagnosed with diabetes. And so it is that southeast part of the United States where it covers some parts of Alabama, Mississippi, Tennessee, and Georgia. And so we're just trying to be more conscious of how we manage and how we prevent diabetes in this area.
Okay, and again, let's go over some symptoms for people that, feel that they definitely need to, I guess, first off, too, it's so important to get those checkups,
get
your
checked.
numbers. But what are some symptoms, some common symptoms that seem to be a true sign that there could be a problem?
Yeah, so some common symptoms is thirstiness. You always feel like you're thirsty, frequent urination, if you feel tingling on your fingertips and on your toes, tired, if your weight fluctuates, if you realize you're gaining weight and then losing weight. These things you want to kind of be mindful of and ask to be checked. When it comes to pre-diabetes, now you might not experience those symptoms, and so it's important that even if you do not have diabetes, to ask to get checked for pre-diabetes.
Okay, and there's something called a diabetic or score that you have. Talk to me a little bit
Yes.
about that. I guess, again, is probably knowing your numbers.
Knowing your numbers. And so there's an assessment that you can actually take to kind of see your risk level. When it comes to your score, there's your A1C levels, and then there's your blood glucose that your primary care doctor can check for you because you want to make sure that you're in the right range. I always refer people to their primary care doctor because, depending on your level of activity, what you do, the numbers might change. But when it comes to the A1C Around 6 is good
Right.
when it comes to your blood glucose. 126 and below
Okay, are
is
good
in that
numbers.
range that you want to be.
And it's also challenging because I know, friends that have children that have come, have had developed symptoms and had this, and it can just be, such a struggle trying to just manage that
is.
daily. But I
It
guess
is.
even with children, if they're complaining about, I guess being thirsty a lot, being extra fatigued, then definitely get them in for a checkup as well.
Yes, and diabetes is one of those conditions where, at first we thought it was only for the older population. But now a lot of younger kids are seeing it. So diabetes, it doesn't care who you are. You can be male or female. You can be young or old. It just loves people.
Right.
And so what we need to do is say, hey, no, not today.
Right.
And get checked, even if you have children. If it's in your family, get checked.
Absolutely, so important. And there are some community centers where people can go to get checked. I think we have some upcoming dates even to tell people about that. But there are some places in Hamilton County they can go.
We sure do. So the Hamilton County Health Department, we do have the Diabetes Prevention Program.
Okay.
It is a year-long program, but it's more of a support system where we walk people through, risk factors, what to do. We share recipes and a lot of different tips. And so that program is starting in January. We do have 2 upcoming events. That's going to be in December, and you can check our calendar for more events. But the Erlanger's
Right.
Medical Center,
We've got
Memorial
them right
Medical Centers,
there.
that's
Yes.
correct. They do
Okay.
have a lot of different diabetes programs that we can kind of look forward to help us to prevent and manage as we get towards the holiday
Right,
season.
and we've got those dates available right there about the community meetings. I also want to mention that the American Diabetes Association has a wonderful website at justdiabetes.org, and for more information, they can also visit the Hamilton County website as well. And we're going to put up a graphic there so people can get more information on it as well.
Thank you so much.
Thank you. Some great, very important tips, and there it is right there to get more information about the community centers where you can go to get checked and know your numbers. Thank you again so much
Thank
for being here
you.
for that great information. And we still have more Let's Chat right ahead.